Bruce Jancin from Elsevier Global Medical News, reporting from New Orleans at the annual scientific sessions of the American Heart Association, where I'm talking with Dr. Kenna Stephenson, a family physician at University of Texas Health Science Center at Tyler, who's been doing some very interesting work on compounded topical hormonal therapy in symptomatic menopausal women. Could you tell us a little bit about your work?
Yes, our work is very exciting. We think about 45 to 50 million women are facing a decision about hormone therapies. They may be in the perimenopausal transition or may be postmenopausal, but after the Women's Health Initiative, they're very worried about taking hormones. And so we are investigating compounded hormones. This is an increasingly popular option among a lot of baby boomer patients. They go to a compounding pharmacy and the pharmacist makes a transdermal plant-derived hormone tailored for them and their specific needs.
In your study that you're presenting here, you report on 150 women, the changes in the cardiovascular biomarkers, CRP and the others. What did you find there?
Well, what we see is some negative attitudes or concerns among physicians about these hormones having the same types of risks and adverse events as conventional hormone therapy. And so we investigated intermediate biomarkers of cardiovascular disease such as inflammatory factors, lipid factors, blood pressure, as well as symptoms. And what we found was that the women using this type of hormone therapy did not have any elevations in their clotting risks, looking at factor 7, factor 8, C-reactive protein, and fibrinogen. We also saw favorable changes with their triglycerides decreasing, their fasting glucose coming down, as well as their blood pressure. And finally, what was most important to the women is that their symptoms were relieved.
And how can physicians be sure that they're dealing with a skilled expert compounding pharmacist?
I think that the experience of a compounding pharmacist makes a big difference. Physicians should seek out a pharmacist that has specific training in compounding and that also meets USP standards as recognized by the FDA on policies related to compounding drugs. And there are compounding pharmacies all over the United States, so most communities should have access to someone with training.
So this is an approach that you're taking not only in your clinical research but in your own clinical practice?
I have transitioned to this type of hormone therapy in my clinical practice after having many favorable experiences and with further justification through our research on the benefits and decreased risk of harm.